early pandemic January days, um, actually before I even declared my Holy Mother of God, this is going to be a thermonuclear level bad pandemic for COVID. Um, WHO actually declined to declare a public health emergency many, many times. I think they declined it twice. And only after they met the third time did they finally say, okay, maybe this new novel coronavirus from Wuhan is a public health emergency of international concern. And finally, that was done like I think January 26th or 28th. You guys can check the date, but it was incredibly late after several punts and deferrals of not declaring it. And I think we're in that kind of phase again where we're kind of playing, footsie with, oh, should we declare? Should we not declare? But I think we all know that the lesson from COVID is that not declaring was a grave mistake. And Dr. Mike Ryan of WHO rightfully said later, obviously in March 2020, that, if you want to be 100% certain about something before you act in a pandemic, you'll lose. And I think we're losing badly because the exponential rate of increase, as you can see globally, and this is even with a very limited testing capacity in many countries. I think US, I think in New York, they were just saying you can only get 20 people tested in a single day is just abysmal.
Yeah.
And
so let me pick it up from there for a bit. I think the critical point is the following. We know from experience and knowledge of smallpox and knowledge of monkeypox how to stop this. And it can be done basically with rapid and effective case identification and contact tracing and an appropriate isolation and quarantine of only a few people, and it can be stopped. And the way to do this is just to really make clear to everybody what the symptoms are, and given those symptoms, give people the opportunity to report their symptoms and be tested. And right now, as Eric said, the capacity for testing is already being exceeded, and that's going to undermine the ability to identify cases. So the longer we wait, the worse it'll get. If we don't respond, if we respond quickly, then we can have adequate capacity, we can have the ability to test.